Now, every day, about 10 people die from unintentional drowning. Of these, 2 will tragically be children aged 14 or younger. And with summer right around the corner, we want to make sure that kids are safe when they hit the water this year, as so many are going to do very soon. So joining us now, Dr. Jen Caudle, a physician and associate professor at Rowan University, and just kind of everywhere on social media and TV. Hardest working doc, right? Good morning to you.
Good morning, Bill. How are you?
I'm doing really well. It's always good to see you.
You too.
All right, so we're kind of transitioning into the warm weather, people starting to get back out into society. So why is it so important for children and adults, really, to learn about water safety?
Well, you mentioned some excellent and important statistics in the beginning of this segment, which is, it really illustrates why it's so important. You know, you said 10 people per day die from unintentional drowning. That's a lot. Not only that, drowning is the 5th leading cause of unintentional injury death for people of all ages. And then the little ones, kids 1 to 4, have the highest rates of drowning. This is why it's so important for us to take precautions.
Now, a lot of times people wait, and I know you've seen them too, those videos where really young kids are in the water, at least learning how to float and kind of protect themselves. What age should kids start learning how to swim or at least float?
You know, that's a really interesting question. You know, there are a lot of amazing swimming programs out there that specialize in teaching children how to swim. You know, I think this is an important thing for families to discuss, and it's really important for parents to make sure their children learn how to swim. So consulting those sort of those swimming programs that are geared and certified to train young children is going to be really important, but definitely a good idea.
I guess it seems like it should be obvious, right? Kind of pay attention to your child. But there are some specific risk factors that you should be aware of or paying attention to as it relates to drowning.
Yeah, there are. And, you know, the one thing we just talked about actually is not being able to swim. That is a risk factor for drowning. So if there's no better reason to get your child swimming lessons, it would be that. There's also things like, you know, if a swimming pool doesn't have the appropriate barriers, and what we want is a 4-sided barrier. You say, what's a 4-sided barrier? That means a barrier that goes all the way around the pool and separates the pool from the house. Also, lack of supervision. You said that this should be commonplace and everyone should know it, but sometimes it can be difficult and not always happen. And then also understanding the location and which locations have risks. Kids 1 to 4 most commonly drown in home swimming pools. So we need to keep that in mind. Kids not wearing life jackets, alcohol use for adolescents and older adults. And then interestingly enough, seizure disorders, those children who have seizure disorders are at highest risk. And then of course, not knowing CPR really puts any and all of us at risk if something were to happen.
Yeah, we did CPR training not that long ago, and it's really not that hard to learn. So this is something I'm guessing you encourage everyone, but certainly people who have or are around pools and water.
Absolutely. And you're right about that, though. It really is important for everyone to learn CPR, honestly, so that you know what to do in an emergency, whether you're around a pool or somewhere else. Definitely important.
Now, one of the things that I guess we don't talk about as much is that someone can develop coughing or trouble breathing after the fact. I guess delayed drowning is something we've heard about. So what do people need to look for if these kind of symptoms develop later?
Yeah, so we don't usually use the words delayed drowning and dry drowning and things like that. I think one of the things that's really most important is for parents to watch their children and to understand when something is not right. You know, if a child gets submerged in water during swimming, comes out, is coughing, and the coughing doesn't stop, or it gets worse, or they don't seem like themselves, or something just seems off, whether they've been submerged in water that you've seen or not, make sure you get them to emergency care, that they are evaluated by a medical professional right away.
Okay, so you don't necessarily have to associate that with water or drowning. Just pay attention.
Always pay attention, always pay attention. But certainly when we're talking about water safety and being around water, you know, remember sometimes parents and caretakers don't see everything that's happening with a child. They may not see that the child goes underwater. That's what I meant. Okay. The idea is just pay attention to your child very closely.
Always a pleasure, Doc. Great to talk to you.
Thank
you. Have a great morning.
You too. You too.
Take care.